Welcome back. Let us now shift focus to an important issue now. The death toll in Bihar has now crossed 130, 110 in Muzaffarpur alone. But Bihar is not the only story of apathy. A 5-year-old baby died as her parents were tossed around from one hospital to another in Bareilly. Is apathy killing our babies? Is that the real epidemic in this country? We're going to talk about this and what steps can be taken as we go along, because trust me, not just terrorism, I would say even this too is a big issue, because India's healthcare, as that caption says on the screen, seems to be in the ICU. Let me introduce our guest this evening, Dr. V.K. Monga. He's the chairman of the Hospital Board of India. He's with us. Dr. Namrata Jetli, Deputy Director Policy and Program Impact, Save the Children, is also with us. Thank you so much for coming to NDTV. We also have Dr. R.K. Verma with us in the studio. Mamta Kale, leader and BJP spokesperson, is with us. Let me now first begin with you, Dr. Verma. Would you or would you not admit that our healthcare apparatus is in a state, is in ICU?
No, not the least. Please. See, as
I'll tell you why I'm oversimplifying. I run the risk of oversimplifying this, but I'll tell you why I'm saying this. First, you reply.
See, understand, India is one of the best health destination, treatment destination. There's a lot of medical tourism. There's a lot of money, funds, and patients coming not only from Far East or African countries, from even US and UK. So, health facilities in India are at the par.
But that's the irony.
Not only at par, could be better and much economical.
Only for a few.
No, for everybody. It's for everybody.
In Muzaffarpur?
In Muzaffarpur, what you are seeing is a different situation. It's a different situation. We cannot blame, you cannot extrapolate Muzaffarnagar to the whole country. Medical tourism, medical faith that patients across the globe have for the Indian doctors, Indian hospitals, Indian paramedics is beyond comparison. So, that is the strongest weapon. Indian doctors are making their name across the globe, be it UK, USA, Africa, or any other country, you name it. So, it's not the lack of the thing. The Indian medical health facilities among the best in the world, I can say with very strong conviction. What we are seeing in Muzaffarnagar or certain pockets, India is a vast country. Whatever vigilance you may observe, whatever surveillance you may do, we may fail at some pockets. We are shameful. We are shameful of that. No child should die. For that matter, nobody should die even 1 minute before his destined death.
Okay.
But here the situation is different. It is not an encephalitis. It is a malnutrition related encephalopathy, for which it is not the doctors which are responsible. Doctors treat after the disease has occurred. It is patients who are coming to the hospital, they are flooding the hospital, doctors, nurses, paramedics, whole city is working day and day out to save the patients. Doctors don't cause the disease. So, don't say the healthcare is in ICU. Malnutrition is a perennial problem. And I still say with conviction, you are good in data, when this country became independent.
No, I totally understand that, Dr. Verma, but my point is that undernourishment is not a phenomenon that has recently been discovered in the year 2019. It has existed, and the government data will show that undernourishment is coming down. Yet you have a situation like this.
What is happening?
Was the government ill-equipped to predict something like this from happening?
The epidemics are unpredictable to by and large.
Okay.
Just to remind you, the predictable epidemic was the polio, which under the leadership of same Mr. Harshvardhan, under his flagship, this country removed polio from the India now for more than 10 years.
Okay.
With the same health structure, with the same media, with the same society, with paramedics.
Okay.
And we are destined to absolutely scrap it from the country's. And next goal is tuberculosis. And I'll assure you that these health facilities, these doctors, these paramedics, the nurses will join with you, join with the society to remove tuberculosis on the map of India.
That's good enough, but so do you think we need a concerted approach and not just individual approaches or specific approach to eradicate, say, just a disease? Because today you will eradicate tuberculosis, tomorrow there will be something else. In this case, it's encephalitis, which is painful. I mean, 130 deaths in this day and age should be shameful
it is
and painful.
shameful, it is very
Yes.
deplorable, we are sad for that, no
Okay.
child should have died.
Okay,
But
Dr. Monga now, Dr. Monga and Dr. Jaitley. I want to, before you begin, I would just like to read out certain facts which Dr. Verma knows because he was there in a previous broadcast. The average spend of the health budget on per one person is 3 rupees in this country. The total portion of the GDP ideally should be 6%. It is at 1.3 right now, right? The country has about 11.49 lakh doctors. There are 11,000, for every 11,000 people, there is one doctor. That's the average of this country. The WHO mandates that there should be one doctor per 1,000 people. Do you think somewhere fundamentally we have gone wrong in understanding that if you don't have a healthy country, then you may want to save us with, you know, a strong defense. But it's this crippling healthcare which will kill more than terrorism.
You're right, I do agree with most of your points. The issue is it has never been a priority for any government except the recent government, which they started. We'll talk about it later.
Sure.
But 1.2 of the percent of the GDP, where health, is never taken as a priority, especially the preventive part of it. And in a country where you have health ministers who are 8th or 10th class pass in your state, you cannot expect better than this, number one. Number two is there is no planning, there is no protocols for this. A 5-day-old child has died after reaching in a hospital. It means there was no protocol that what is to be followed and what is not to be followed. We'll talk about it later also. But even in a knee-jerk reaction like Muzaffarpur, where the whole world is focusing upon shortage of doctors. You can fetch doctors from Patna, you can get them from Darbhanga, but they are not doing it. There is a shortage of IV fluids, 10% of dextrose is not available. There is a shortage of medicines, there is a shortage of pharmacists, there is a shortage of nurses, there is a shortage of beds, there is a shortage of ICU, there is almost nil but a nil ventilators in the available. This is in spite of the fact that for the last 15 days, all ministers and everybody are going there.
So you're saying the words ring hollow. Essentially, they ring hollow.
About
by saying that you're prepared.
Yes. About malnutrition also. Why should a country suffer from malnutrition? And then how much are you making them aware? In the last 18 days, still people are coming. It's not a disease which you get an infection today and you get the disease after 5 days. In this, you eat lychees, unripe lychees in the night, empty stomach. Don't eat anything in the night. Next day you are sick, and maybe in the next 3-4 days you are dead also. So these type of things, people should have been made aware. Pamphlets should have been distributed. People should have gone. Asha workers and Anganwadi workers should have gone from door to door, home to home, to tell that people don't send your children to the place.
So it's a systemic failure, according to you.
It is a system.
Okay, Dr. Jaitley, some more figures, because I feel that this story has to be understood with facts, right? And I'm just saying that for anyone, for any government which prides itself in being nationalistic, has to look at these facts. I'm not going to talk about the previous governments, what they have done, they're paying the price for it, but the expectation of the new government is this. India houses 50% of the undernourished children of the world. 8% of the children in this country are severely, acutely malnourished. Underweight children in rural areas is 38%, that in urban areas is 29%. This is government data. I would also like to add, and this is a very, since we are talking about Bihar and this is significant, we'll put up those figures on the screen. Do you know, if you have a comparison between the healthcare centers in Bihar versus the population growth in Bihar, and you take the period of 2012 to 2018, the number of healthcare center increase in the state of Bihar is 2.6%, whereas the population increase in the state of Bihar, according to the census, is 17.3%. And then you have shortage, and then you don't have the facilities. How can we ever expect anything with such figures?
No, I'm very glad that we are having this debate and you are actually talking about hard figures. Let me add another figure to your list of figures. As per NFHS 38.4% of children are stunted. Now, what is very, very important is that it is unfortunate that we have incidences like Muzaffarpur, where everyone suddenly starts talking about malnutrition and children dying, while like a knee-jerk reaction. But that is not, why should it be that we have incidences and crises like this, where the whole country starts looking at issues related, which are so critical. And what is really, really unfortunate, and this is not only this case here, that if you see the children who are dying are malnourished, they are from the poor communities, and while there's been a whole discussion and debate on the, the biomedical etiology of what happened in Muzaffarpur, but the socio-ecological etiology of this whole incident has to be understood. And we need to recognize that what is very, very essential is definitely the public health system, there is a lot more that needs to be done to strengthen it. But what we have to also highlight is how can we prevent it, the prevention part of it. The prevention part of it is also very, very important. And I don't think you require substantial amount of resources to be able to, undertake, certain level of, community mobilization, awareness generation of parents, vis-a-vis, how they should be having, how they should be feeding nutritious food to children. Simple things like breastfeeding, complementary feeding. Now, those are components which are already there in the government's program. But it is just that we are not providing importance to it, enough importance to it. And here I would like to say it's not only the government, it is the civil society organizations, the NGOs, the media. I think we all, the family, it has to be a collaborative effort because it's not a simple, it's a problem which has much more deep rooted,
correct. And in most of these cases, I believe, as Dr. Verma was also saying, that it's not the disease, but the fact that your body is not strong enough to deal with that disease. It's what causes the death. Fair enough, but my point is that by now, see, while I agree that Dr. Verma, there might have been a slight improvement and we would have been a lot worse, say 2 or 3 decades ago, from the 50%, from housing 50% of the world's undernourished population. I'm sure we have improved, but even this is a blot. See, this figure is a blot.
See, for statistician, for data, we can always give a negative data, but you must remember the same doctors, same hospitals, same nurses, same paramedics, same media helped this country to increase the survival rate. When India became independent some 70 years back, the expected life expectancy of a male was only 51 years and expectancy for a female was less than 50 years. Today it is hugging 70 years. So those 20 years have been added by the same healthcare system. Secondly, as Dr. Monga pointed out, the government is doing Skill India, Swasth India, Swachh India, and tomorrow is International Yoga Day. So government is putting a lot of emphasis on healthy living. That includes not only the medical doctors like us, paramedics, private practitioners, media houses, Verma, they all are supporting healthy living.
The problem over here is that we may talk about healthy living, which is a long-term goal, right? But then there is an immediate problem. For instance, the point that was highlighted, and I'd like to go to Mamta Kale now, she's the political representative on this panel. Mamta, how hard was it, right? Because you are part of the government in Bihar. You are the government in Bihar. How hard was it to get doctors from neighboring districts, or get in more beds, or set up emergency hospitals? We have reports, there are multiple reports that there is a crisis-like situation in Muzaffarpur. And I'm sure you are also aware.
Sanket, firstly, it is very disheartening to see 130 kids, seeing them dead, and seeing this sad and untimely demise of these lovely children. Having said that, it is absolutely correct that hospital requires good equipment, good infrastructure. But at the same time, we need to understand that this particular disease was caused by a virus, and we see this in various parts of our country, like we had seen it in Kerala when Nipah virus had attacked Kerala, and almost 700 people got infected of this virus, and almost 70 to 75% people died. So we really need to understand as to where these viruses are coming from, what is it, and how we nip the problem, and what are the solution to medical fraternity, and of course those particular government of those state need to work on
I'll give you an example. Let me give you another example. You're talking about long-term solutions, Mamta Kale.
But this virus was the cause of the death of these
Yes, virus
things.
was the cause, but do you know what could have helped find out the reason and perhaps the proverbial stitch in time, which would have helped save 9? There was I hope you know that there was a proposal 4 years ago made by the then Finance Minister Arun Jaitley of having an AIIMS, a second AIIMS in Bihar. Do you know what is the status of it right now? Governments are squabbling where land should be allotted. Now, if this would not have happened, had land been allotted, by now you would have had a state-of-the-art hospital in which research would have been happening. If nothing else, there would have been a capacity to deal with this crisis. That's what I'm talking about, Mamta Kale.
No, even this present hospital, which has 610 beds, can actually accommodate 2,000 beds. And the Chief Minister of Bihar has just recently, during his visit, has announced that he should upgrade, and he wishes to upgrade the beds of that particular hospital from 610 to 2,500.
We are only discussing this in the context of 135 deaths.
Can I complete now, please?
Sure.
Yeah. If you talk about the center government taking measures in terms of health care, let me tell you, this government has been the most sincere and most responsible and most proactive when it comes about the health care of India. You be it Ayushman Bharat, Swachh Bharat, water supply, or even the yoga day. So we have been looking into this aspect, because we know the government understand that health care is the most important thing which has to be provided to the people of this country. And as we know that India is providing the best of health care, not only to Indians but to people abroad, and that is why it is a medical destination for people living abroad.
We are presenting yoga. It may be a part of a lifestyle change, Mamta Kale, but trust me, yoga won't cure encephalitis. Speak to any whiz doctor.
I talked about Ayushman Bharat. People who cannot afford to go to private hospital after this Ayushman Bharat can walk into private hospital as well. That is the most important measure and scheme which has been announced and thereafter rolled by this present government.
Okay.
Number one. And even Swachh Bharat is very much related for healthy living. If we have clean environment, clean surrounding, nothing, these viruses wouldn't attack us and wouldn't even grow there. Please understand that. And as a society, as the responsible citizen of this nation, the responsibility lies on our shoulders as well to keep our surrounding clean.
Absolutely.
When we go and visit the hospitals, we see people throwing the garbage wherever they feel like. I think this is the responsibility which lies on our shoulders to educate people and become proactive and not
two things over here. Mamta Kale, I've heard you.
And Ayushman Bharat also to be talked about, and this is the same government who made this nation polio free. Under the same health minister Shri Harshvardhan ji, this nation was made polio free. So this is the government
if something
which
good comes out
towards the health care.
As we go along, if something good comes out, if you are able to make this country encephalitis free, it will be a reason to celebrate, right? But at this moment, if I look at the data, if I look at figures, you may, Dr. Verma, tell me that there is a way of looking at data. It can talk about achievements, but it can talk about failures as well. No part of this is talking achievement anywhere, frankly.
See, understand, it is not only a virus, it's an encephalopathy. As I told you, I tried to describe to you. The body has got reserve of energy in the form of glucogen and fat in liver. It is also known as yakrit in Hindi. That is a reserve for the body. Whenever we fast, anybody, the liver releases the extra stored energy in the form of glucose. Brain
No, but
requires.
Dr. Verma, you have explained this in great detail. All I want to know is that why could it not have been prevented this time around? I'll explain with the help of another fact. If you notice that encephalitis deaths in Bihar in the year 2011 were 54, in 2012 were 120, right? Alarming increase. Then in 2014 it became 90, in 2016 it came down to 4, in 2017 it was 11, and now it has crossed 135 again. So you were able to control. The government
I assure
was
you
able
again,
to take efforts to control it, bring it down to 4.
assuring you, the medical fraternity will be again able to control it. These kind of epidemics have to be prevented. There is no debate on that point. And we should be more vigilant, more hardworking, take full cooperation of paramedics, doctors, nurses, everybody, and including media, to prevent such kind of epidemics in future.
Okay.
And it is possible. I fully agree with you. It is very much possible and should be possible.
Okay. Okay.
Okay.
Yes. Yes.
Basic issue is, I have a report in 2012 when there were many cases. Dr. Jacob, in a fact-finding mission, they had gone there, and then they diagnosed that this is because of lychee and malnutrition and all what.
Yeah.
And they gave some recommendations also, and none of them were filled up. And the latest report which they have given only around 4 or 5 days back about the resurgence of the disease is that we have not really taken care of the recommendations of the committee. Had we done anything about it, we would not have seen this day. This is definitely, as Dr. Verma is saying, preventable. This will be prevented, but definitely why should our small children die of a disease which is preventable? And once you are talking about the infrastructure and other things also, when we got independence, I'll go back a little.
Sure.
Only 10% of this was healthcare was in private sector, 90% was with the government. Over the years, the increase in population, increase in the requirements, but the government was not really able to cope up with that. Then came the usefulness of the private sector. Small clinics, then solo clinics, then husband-wife clinics, small nursing homes, large clinics, and then came the corporate hospitals. And then what Dr. Verma was saying, I mean, this is a saving grace for the country that private sector has built in so much of infrastructure that we are talking about people coming from abroad as a tourism, medical tourism and other things also.
No, but this is the irony of ironies.
But we have not been able to take care of the primary health centers.
Yeah. For instance, tell me one state-of-the-art hospital in Muzaffarpur. Right?
Yes.
It's a problem. I mean, we can have all designer 5-star hospitals in the national capital or elsewhere in different
but
cities.
we need more
and people
primary
can fly
health
in from Dubai or wherever they want.
Yes.
It's not going to help our citizens.
It is the state cannot abdicate their responsibility on the healthcare, the public healthcare, especially when we are talking about children and the reaching the last mile, reaching the last child. And I think there definitely our public health system needs to be strengthened. I just wanted to give you just one illustration in terms of how this can be prevented. And I read about a case study about Chandrabhati village, which is just about 10 kilometers away from Muzaffarnagar, where while all the deaths were happening, Muzaffarpur, there was not a single death which happened in Chandrabhati village. And that was because, because it's a recurrent phenomena in Bihar, in that particular region. The village community, along with other, key influencers were able to prevent it by doing simple things like, doing awareness generation, some kind of preventive components, ensuring that the families were able to identify initial symptoms, they were able to timely refer the children. So all I'm trying to say is that it is possible. It is just that there has to be an intent.
Just like Swachh Bharat.
Yes.
It is not only doctor, it is a committee who has to be involved.
Absolutely.
But
if
we
they
have
give
to
a
have
small,
that
simple
intent,
meal to an
Right.
infant, if you give simple meal
but
to
then
infant,
I would say at this moment, the responsibility of mobilizing that community also rests with the political
And it
class.
has to be a structured,
If a Swachh Bharat can be done in this
Of
country,
course.
which I think nobody who's in a sane,
responsible citizen of
no
the
sane
nation
mind
should
will
take
say that
this
Swachh Bharat is bad.
responsibility,
so
no?
we are as doctors, we cannot say about other things.
No.
But I am just saying that as we agree.
I'm talking about the government's accountability. Mamta, very quickly, last word. Government's accountability. Do you think that your ally and you also, because you are the government in Bihar, failed in understanding this very basic requirement? Because the Chief Minister of Bihar is so interested in a proportional representation. How about some proportional accountability?
See, you know, as far as Bihar government is concerned, they should be putting in best foot forward and leaving no stone unturned to whatever it takes to give infrastructure, medical equipment and everything there, and the center government is doing whatever it takes, every possible thing right from day one, right from 2014, and committed to do so all throughout. That is for sure, and the whole nation knows about it. But I also want to talk about this virus thing, which is be it Nipah virus or this ACE virus. We must understand how does it spread and what does it do to our body and how does it come close to us and how does it gets into our body. We must understand that as well, and of course we need to address the malnutrition problem too.
Okay. Let's just hope that it goes beyond a television debate. It leads to a spread of awareness, and I would say there has been, if you compare the two
and
financial
media should
years,
also be a positive partner to this.
Absolutely, and NDTV plays a very significant role as far as social and civic issues are concerned. I bet no other television station does. I bet nobody else does. We take this seriously. You have the health budget increasing. There's been a 16% increase over last year. But just increasing the budget and the facilities not reaching, the last mile connectivity, that's really the problem. We have to fix this both in the short term and the long. Thank you very much to all the expert panel of doctors as well as Mamta Kale. That's a wrap in this edition of Left, Right and Centre. Good night and goodbye.